Hello, 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 everyone, and welcome to Dr. Toomer Talks. Thank you for joining us. If you're here, please say hello. And if you're watching later, just put hashtag replay so that we know you've been here. So, as you know, Tuesday Talks are my thing, and I have Dr. Olabintin.
Yes.
I should have asked you first how to make sure. I'm
Good.
so
That's
used to
good.
just calling you Tolu. I forgot. I'm like,
Very,
I
very
didn't even
good.
check to make sure I say your name right. And then, anyway, she's here today, family medicine physician, co-founder of Living Spring Family Medical Center. So we got a lot to talk about. We're going to be talking about some health stuff. We talk about wellness. We talk about weight loss. So we'll just go where it goes. So I'm going to let her introduce herself and let you all know who she is.
All right. Thank you so much for inviting me, by the way, Dr. Tuma. I'm awed to be on this show. So thank you. I am Dr. Olabintin, Dr. O for short, and I'm a family physician and the co-founder and CEO of Living Spring Family Medical Center here in the awesome city of Mansfield, Texas, where we help patients live long and well because we believe the quality of life is just as important as the quantity of life. So I'm glad to come on here and chat a little bit about healthy.
Healthy stuff.
Yeah.
So, yeah, one of the things we talk a lot about, I'm first going to say hello to Dr. White. Hey, Janine, thank you for joining us. And anyone else watching, please say hello. So, we hear a lot about health. Be healthy, do eat healthy food, do have healthy habits. It, you know, I've often described health as when your body, your life, the biopsychosocial, your body, your psych, and your social life are all in tune and you feel good about where you are and all those things. How would you describe health in terms of like when you're trying to get your patients to say, okay, do something healthy, and they're like, what does that mean? What do you say to them?
It's more, for me, a quality of life issue. Like, healthy to anyone or to you, or encourage healthy to you mean get you in the best shape to do the things that matter the most to you.
Hmm.
And so there's a variant, or there's a gradient. So can you always be healthier? Yeah, sure. You exercise every day. Could you exercise more? Could you drink more water? Maybe, maybe not. Could you smile more? Could you rest more? Could you think more positive thoughts that help your mental health? Yes. So there's always a spectrum. But it's, painting the idea of you being in the best shape possible, given your circumstances, past medical history, current medical conditions, social conditions. Like, how can we optimize you so that you can enjoy the things that matter the most to you? It's it.
And so when you see a new patient, like they come and see you and you start to assess them and you start trying to figure out what it is that you need to do, what are the most important things or do you pay attention to? And what's the most important things for people themselves to start paying attention to in terms of their own health and
So now,
wellness?
I'll be honest with you. Doctor eyes are on. I'm looking at the blood pressure. I'm looking at family history. I'm looking at complaints. So, is there hypertension symptoms? There's signs of diabetes. There are patterns I see in the family that may be replicated in patients. So I'm already thinking that. But then I don't start out with that because that's my issue. It's more, and maybe the patients as well. But so why are you here? Um, you know, and sometimes I'm just here for a checkup and make sure I'm okay. All right, what are your health goals? What would healthy look like to you? And they're like, oh, some start off with, I want my blood pressure to be good. I want to exercise more. And I'm like, all right, how about you tell me what you think I want to hear, what you really want, not what you think I want to hear. Because it's like this
Yeah.
whole rehearsal. Yeah, I want to exercise more. Okay, why? So then I start to tease out well, I'm gonna have more energy so I can run and play with my grandkids, or I feel kind of ugh, like I get out of breath easily, and I'm like, oh, okay, so being healthier to you, your health goes for this year, maybe more energy, more this, and then the next question is why? Why is that important to you? And sometimes I have the puzzle look like, why ask that question? I'm like, well, I want to know why it's important to you, so we know how much we should fight for that, or how much effort we should put in it, or what to put almost like dangle in front of you so you keep going. So that's kind of how I start the conversation.
Well, before we continue, I just want to say hello, Tanya. Hello, Chris. Thank you for joining. Those are regulars here. Um, so as you know, I help people lose weight rather successfully, and using a biopsychosocial approach. So I just look at the whole person, which again, I know that you also do the same thing. You look at the whole person. I'm going to say hi to my Aunt Cynthia. She just joined. Um, and so I get people who come to me asking them to help them lose weight because they just feel like that is the issue. Whatever ailing them, whatever is bothering them, whatever is going on that they don't like in their life, they figure if I lose weight, it will fix everything. When you have patients who come to you and ask and say, first of all, what do you do when someone comes to you and asks you for help to lose weight? And then how do you broach the subject when you feel that weight loss actually is the issue that needs to be addressed in order to help someone with some of the things that are bothering them?
So I tend to ask, typical questions. How long has this been an issue? Why is this an issue? And then, and between the person screams and we've already had icebreaker type conversations before I can start to do this. Then they tell me, well, I've always been a big girl for this long, and I kind of look different, or I don't feel most beautiful this way, or I huff
Mhm.
and puff, like I feel like I'm tired easily, and I want more energy, and or a big one, especially from ortho, is my knees hurt, my hips hurt, and everybody says it's my weight. So I want to come fix my weight so maybe I would hurt less.
Yeah.
And there's some truth to that, yes. But regardless of what the issue is, if the patient is like, you know what, I'm ready to do this, we start talking the whys. We start talking long term. We start talking what have been challenges before um, to get in the ideal weight, and then we also talk what's ideal for you.
Yeah.
And then I try not to look at the number so much. I say, okay, you know what? Let's work towards the why. I want to lose weight because I want to have more energy. Okay, let's answer the questions. Are you sleeping well? Are you drinking water enough? How's your stress level? Those
Yes.
kind of
That's a
questions.
big one.
Who's your support system?
Yes.
Who's here to help, champion you in this weight loss journey of
Hmm.
yours? And what have you tried before and been successful with? What have you tried before and failed? What would you be
Hmm.
willing to try again? And which one would be most sustainable? And what could you do for the rest of your life if you had to?
Yeah.
So that tends to lead us in different ways as far as if you could exercise one type of way for the rest of your life, what would that be? And how can we make it fun? It's
Yes.
not like a
Yes.
punishment because I'm not here to tell you do this, do this, do this. It's let's make it sustainable.
Exactly, exactly. Well, before you continue, I'm going to say hello to Dr. Gilliard, who has joined us. Um, and so, when I had a question right there as you were talking, and I lost it, which is usually why I keep a pen and paper right next to me so I can start writing things down. But I'm so excited that you're here. It's like my,
I
I
never
just
tell
like I
you
just
to
want to talk.
look at mine. I got mine. I'm like, shoot, what am I
No.
just don't forget?
So I know what I wanted to ask you. Um, so tell me, what is Living Spring Family Medical Center? Where is it? What do you do? How does someone find you? What should they expect when they come to see you? Would they expect to see you? Are there other people there that are working with you that they may see instead? How does that work?
All right. So Living Spring Family Medical Center is a family medicine center where we tend to take care of the whole family. We tend to lean more towards the 4-year-olds and up. And the biggest emphasis is preventive medicine. Of course, we manage chronic conditions too, but I'm very big on using lifestyle and food and changes to and some medications, of course, to help you live the best life. Um, Now, I do have a team. I will be honest with you, it takes a team to run a practice efficiently, so I'm not going to downplay that.
Absolutely.
I do have a nurse practitioner that works with me,
Okay.
but it's a collaborative effort where I see you typically the first time and then you see her as a follow up, depending on what we're treating you for. I do have patients who insist on seeing me only, and that's earmarked in their chart, so that's an option too. But one of the things I'm very particular to do is to train my staff to be like me and to understand the reasoning, the whys behind why I am the way I am. So they're teaching sessions, and so it's not like you're seeing a very totally different person. You're seeing an extension of myself when you come
I
to the
see.
practice. Mhm.
So then. when someone does come to see you, and just in general, and this is something that we talk about a lot, particularly in weight loss, is to be patient. One of the biggest issues I see with people is they're impatient. They want the result, but they're not focusing as much on the process or enjoying the process or realizing the process itself. Really, like as I say, the journey is the destination. It's going to take some time and some things to move. So, how do you explain to people what to expect when inching towards an improvement in whatever it is that they want? Either it's blood pressure, diabetes, weight loss, becoming more pain free. Um, Everyone's journey, of course, is different. But how do you help people mitigate their or manage their expectations in that?
Isn't it funny how it doesn't just apply to weight? Isn't it our
Mhm.
life goals? We want it
Yes,
now.
yes,
Like,
yes, yes.
I want to reach that place now. I want to get to there now. And so with this, it's simply painting the same picture. Like, we've been through this before where we try the quick fixes. And I'm glad there are medications that help address some of the underlying causes of the disease of obesity. So that's fair. But like when the shortage happened or when
Hmm.
you can't afford to buy the medicine, then what's left? And you're left to just that. So it's a combined effort. So I say your part, my part, your community's part, your health coach part, your my nurse practitioner where you do the follow up part, the medication part too. So it's who you become through the journey is also worth it. So I encourage patients not to give up on themselves if they don't see the results they want instantaneously. I also teach them that there are other ways to measure success. Man, look, you have more energy. The weight may not be going down, but your abdominal circumference, the way it fits is looser. You have more glow. You have more pep in your step. You seem more radiant and more joyful. Those are measurable things, and so I have to do a good job of reminding them of their own wins, their own victory, because it's hard to see. I have people take pictures all the time. Like, take pictures, take selfies. Same thing with if you have a bump on your skin. I say, take a picture and see that and put a coin next to it. You see that it's actually improving because if you stare at something
Hmm.
long enough,
You
you don't
can't
see
see
any
it.
improvement, right?
You don't see
So
the
it's
change. Exactly.
telling them that you are actually making progress. And in between visits, making sure they're connected to someone, either a nutritionist or a coach, who would keep them accountable. Because let's all be honest, we could all use some positive peer pressure, and we all
Yes,
do. And
yes.
so creating systems for them, encouraging them not to give up on their own fight.
Hmm.
I've had people who I was, one of their, like, let me just try you kind of
Hmm.
thing. I had one BMI over 71. Like, I just wanted to try you. And, the way you talk to me looked like a person. So look at me like a person. And then we have a sign in the clinic that says, your weight is not a reflection of who you are, your worth, your beauty. You have to remember
Hmm.
that this is just a numerical value. And
Yes.
so I think when you make people feel heard and that they are important and that they're beautiful the way they are, even as they're inching towards something better, they're more likely to also take up their own fight.
Hmm.
We're
Yeah.
sometimes having to carry a big, but at least
Yeah.
we encourage
Yes.
them to
Yes.
pick up their own fight too.
Hmm. Yes. I agree. As I like to say, weight or health doesn't have a size. You can be healthy at any size at any time. But you've mentioned coaching twice in your answer. So, that's something that's relatively new in medicine. It's relatively new in health. We know about coaches in sports. I think since the pandemic, we're seeing a lot of big explosion in coaching. But when it comes to your health, when it comes to things needing to improve, things that you want to improve, how do coaches facilitate that? If our doctors, I know part of what we do, we are coaches
Hmm.
anyway.
Hmm.
We're part cheerleader, part psychologist, part coach, part whatever. But of the coaching part, specifically, how is that different? How does that help more than other part aspects of what it is that you do?
Imagine yourself scared to take on a new challenge. And you have
Hmm.
somebody calling you every day, or just say, "Go, you got this." Just
Hmm.
literally cheering you every step of the way. You're more likely to attempt it just because somebody is there in your corner.
Hmm.
It's like it's common sense, but it sounds woo woo at the same time. I'll be honest with you,
Hmm.
coaching before a couple years ago was like, oh yeah, sure, I just flatter you. I'll be your
Hmm.
psychopath. I'll be your paid psychopath. Just but when you have somebody help you get out of your own head
Uh-huh.
to
Yeah.
meet your goals,
Yes.
Yeah, sometimes you got to pay for that investment,
Mm-hmm.
you
I
know. And
agree.
so and I'll be honest with you, sometimes I feel like a nag. I'll be honest, I'll admit that live, where I feel like I'm saying the same thing over and over again.
Mm-hmm.
And sometimes I feel like if you hear from somebody else, you don't think I'm the one who only thinks like this. You don't think this is the, you know. So sometimes when you hear it from multiple people, at some point,
Mm-hmm.
somebody's conversation will hit something. I actually had a patient recently who was telling me that I should stop talking about her on Facebook, and I'm like, oh my God, I never mentioned it. And she's like, yeah, every time all the things you're saying and all the people you invited, they keep saying the things you say in the office. So fine, I did it. And I'm like, oh my God, I've been trying for a year, but okay, whatever. Whatever it takes to empower you to get
Mm-hmm.
out of, like,
Yeah.
and these are things that empower you naturally. And so
Mm-hmm.
they stay with you.
Yes.
Habits lead to actions, lead to lifestyle. So if we can help you reemphasize new habits by changing how you think about them, hey,
Yeah.
that's the score. It sounds simple, but it also affects other areas of your life. So it's worth it. And you
Mhm.
know, don't believe the hype. Go listen to other people and see their
Yes.
stories. And let
Mm-hmm.
that be, that was for me, like getting the coach, that was my like light bulb moment, like, oh my gosh, I know this person, I know who they were before. Look at how they've changed. I want to
Mm-hmm.
do what they're doing. If it's a coach, you do it. Or get a book to coach you, whatever it takes, person, book, whatever.
Whatever it takes. Yes. And I know that there's, weight loss with coaching. Again, that now when I first started, we really didn't have significant medications that we could use for treatment. And so it really truly was just kind of almost white knuckling it through every single step of the way and just
Mm,
kind of making sure you're bolstering somebody through those steps because there really wasn't much else that we had.
true.
And since we've been given this message that, if you eat right, if you exercise, if you do what you're supposed to, you won't need medication to do anything. And I'm not just talking about weight loss, although that really is quite a thing. So when someone needs medication, they're resistant to it, or when they're shamed for using it, how do you help them? How do you get people to realize that this is important? This is something for your health. This isn't about, vanity. This isn't about anyone else's opinion about what you're doing, but simply, I see it with diabetes often.
Mm-hmm. Mm-hmm.
You see it like
Mm-hmm.
hypertension.
Mm-hmm.
You see it with everything, not just weight loss. How do you convince people? When is it the point where you just say, okay, really, this is what you need for right now? And even when people are resistant to the idea.
So then I asked them, what's your biggest concern? Oh, I don't want to take
Hmm.
medicine. Well, sometimes it's, if you don't take medicine now, in a couple of weeks, months from now, you will take more than this. So it's painting that picture. So
Hmm.
sometimes I'm that direct, depending on how bad the labs are or how sick they are. Then there's also the, what's the issue with it?
Hmm.
Are there a history of side effects? And then I talk about that's not the only approach. And there's a science of obesity too. We now know. I went to the AMA conference, and it's not just, oh, amount in versus amount out.
Hmm.
There's certain neurotransmitters. There's certain things to control your appetite and how hungry you are. And then there's stress. There's your sleep issues. There's access to food. There's a lot of things. There are a lot of things
Hmm.
that affect weight. So I'm going to address it, all of them. But medication is an option. For those who are saying no, I say, you know what? We can try the lifestyle changes. Let's give it a few weeks and then see how far we're able to get. And I also sometimes have lower than recommended doses that I give them. I'll stretch out
Hmm.
sometimes injectables like over a longer course if the insurance will permit, and say, hey, let's try lowest most effective
Hmm.
course. Let's try that. And then I talk about potential side effects and how to combat it early on so you're not shocked. And I say, hey, you're worth trying it, and a closer check, a follow up to see how you're doing with it. Sometimes, depending on what the other comorbidities are, I'm like, please, I'm telling you, like I would my mother, come on, help me now, help me help you, you know.
Yes.
So they're different. They're different. I've had to beg something like, come on, please, you need. I'm beg. I want you. I want to help you more than you want to help yourself. So I need you. And then there's humor too. And so I'm like, all right, fine,
Hmm.
I'll try
You
it.
just use whatever you got.
Whatever it takes.
Whatever it takes.
Yeah, whatever it takes. Yeah.
So tell me, what is tell us again where you are, how someone can find you, and who it is that you help
All
for
right.
anyone who's just joined us since we started.
All right. So you can find me on the World Wide Web, www.livingspringmedicals.com. I am Dr. Olabintin, Olabintin. I'm on YouTube. I'm on TikTok. Well, not really on TikTok, but I'm on Instagram and Facebook. And if you're looking for a doctor who's thorough, who's kind, and who's compassionate, and who will help you live long and well, because she believes that the quality of life is just as important as the quantity of life, I am
Mhm.
in Mansfield, Texas area.
All right. So I have a question though. Do you also do telehealth for anyone else in other parts of Texas?
Yes, yes, I do. All around Texas and in Tennessee as well.
Oh, okay. Well, that's a nice conversation
Hmm.
combination. All
Hmm.
right. Well, thank you so much for having this. Was great. This time goes so fast,
It
doesn't
did.
it?
It did.
So
It did.
you gotta come on again so we
Yes,
can talk
ma'am. Yes, ma'am.
and I thank everyone who joined in. Make sure you put replay, hashtag replay if you watch it later, and join us again next Tuesday for another episode of Dr. Toomer Talks. Thank you. Bye.
Bye.